All right, well, new fears America may be addicted to painkillers. Data showing that about 7 million people use prescription drugs for non-medical reasons. The number dwarfs the 1.5 million addicted to cocaine. So how did prescription painkillers become the drug of choice? Dr. Ernest Patti is a senior attending physician of emergency medicine at St. Barnabas Hospital. Thank you so much for talking to us. You know, annual deaths from painkillers have actually quadrupled in a decade to nearly 15,000, which surpasses both heroin and cocaine. So obviously the first question I have to ask is, how in the world are people getting prescriptions? Who is writing them? How are they getting it so easily?
Healthcare professionals are getting inundated with people's requests for pain medication. Today, people want their pain relieved immediately, quick, and with, usually one pill. Many other modalities can help you relieve chronic pain. Things such as exercise, physical therapy, yoga, manipulation, things like that, proper diet and exercise, all help decrease pain. Yeah. But in today's fast-paced society, people want
doctors, I have to be honest, are very quick to give out pain medicine for anything. I went for a teeth cleaning and I was offered ibuprofen 800 milligram. I'm like, come on. I mean, I know women who had C-sections who didn't have pain. I mean, and they are much tougher than me. But my question is then, where's the regulation? Why isn't the federal government cracking down on this and making sure that people can go in and get maybe one prescription, but they're going out and buying tons and tons of prescriptions and then selling it on the black market?
Well, the problem is some states have lagged behind. New York is a leader in this, and here in New York State, our prescriptions are monitored, they're barcoded. I regularly get reports from the state when a person has come to visit me in the emergency department at our hospital, and they've had multiple pain medications filled for them, prescriptions filled for them. We get notifications of this. Our hospital in the Bronx, St. Barnabas, is the leader in this. We've already gone Demerol free in our hospital, and we've substituted other just as effective pain medications for relieving patients' pain.
This is what's really disturbing to me is the DEA in recent months has been doing some investigating. CVS, Walgreens, two very popular pharmaceutical distributors, and they are actually trying to figure out whether Walgreens has allowed suspiciously high volumes, high sales of this particular pain pill, which are then sold on the black market by drug dealers. How is it that somebody, first of all, goes in and buys a multitude of these drugs without the pharmacist getting suspicious? And are they requiring a photo ID? Much like if you buy Advil cold and sinus behind the counter, they ask for your driver's license. But if somebody goes and picks up a prescription med, they don't ask for an ID.
Usually they don't ask for ID
that makes
for prescription medications. Well, a lot of states lag behind this, and there are many states where people can go, fill a prescription, then go to another physician, get another prescription for pain medicine, fill them, and then inadvertently, or not inadvertently, by necessity, go out and sell those medications on the market. And that's what people do. That's why here in New York, they're barcoded and they're monitored, and we're really trying to crack down on it. It's a scary prospect, buying this stuff on the black market.
Yeah, it really is, and I don't understand why they don't ask for photo ID. I mean, that just seems like such an obvious no-brainer.
It's probably the next step. But
yeah. All right, Dr. Ernest Patti, thank you very much.
Thank you, Julie, for having me.
Yeah, one of the telltale signs is they were paying cash for that, right?
Yeah.
For those drugs.
Yeah.
Cash.
They're not going through them.
All right, Doc. Julie, good to have you here. Yeah. Happy Easter to you and to all of you. That will do it for us. I'm Kelly Wright.
And I'm Julie Banderas. Coming up next, the Journal Editorial Report. Have a great day, everyone, and happy Easter tomorrow.
We are awaiting a news conference with...
And welcome back. We're obviously out on the plaza here in Manhattan, and it's a beautiful day, but the temperatures are on the rise in the Northeast right now. And tomorrow, of course, is the Boston Marathon.
And it is expected to reach nearly 90 degrees in some places. Boston Marathon officials, they're warning some of the runners, maybe you need to rethink tomorrow's big race. So what do you need to know to be safe? Joining us now, Dr. Ernest Patti. He's the senior attending physician of emergency medicine at St. Barnabas Hospital in the Bronx.
Thank you,
what do all
Great
these runners need to know?
They're going to have to remember the importance of a number of different things. Primarily, they have to make sure to hydrate. They also have to make sure to protect their skin from the sun. They need to wear loose-fitting clothing, and I brought some items here that I'd like to show you. Loose-fitting clothing that is comfortable and geared for the athletic type performance, which doesn't bog you down and prevent your body from sweating. Because you want to be able to get rid of that sweat to keep your body cool. Sun visors are important, or some type of protection over your head and brow. We brought some sunscreen along, which is important for the exposed areas that you want to keep from getting burned. Electrolyte solutions are really important. Obviously, you want to go with low-calorie ones, but ones that contain enough of the electrolytes that are needed to replenish the loss you get during heavy exercise. Water is also the primary fluid. And also importance of using sunglasses and sweatbands, things like these to help you be more comfortable as you race.
But go back to this, though, the difference between water's not enough. You also need this.
Well, part of the problem is many competitive athletes, don't know how to properly hydrate themselves. You can actually take too much water before the race, and that leads to a condition that we call dilutional hyponatremia, which is where you actually take too much water and dilute the salt content in your body. That's a serious problem that, if you exercise during that, can lead to a real serious medical condition. It needs to be treated immediately and urgently in the hospital. The problem is you want to take a balanced solution in. So you want to hydrate, but you also want to utilize your water stations as you run your races. Many of these races have watering stations set up. So don't overhydrate before. Make your stops during the route and replenish as you go is better.
Now, our producer, Jay Sirocco, is running the marathon. He's run a lot of them. He's very experienced, and he told me this morning. He said, if you're thirsty while you're running, it's probably too late. You're already dehydrated.
Well, the problem is it's easier to replenish, a lot easier to replenish than to get rid of excess if you've overdone it before the race. That's the bigger problem. So yes, Jay's correct, but that's why they set up the stations throughout the run. So it's a good idea to try to figure out, you can do this in advance. You can figure out your sweat ratio, and that will help you figure out the proper hydration to do prior to your race.
And this is really good advice for people who maybe aren't running a marathon, but they're outside exercising in the heat as well.
Exactly. Anybody who works outdoors, we have men that work and women that work on the roads, repairing them out in the sunlight, people that do manual labor outside. Very, very important to prepare.
If you feel dizzy or you have a headache or a stomach ache, what do?
Those are signs that you're already past that stage and you're entering heat-related illness. You need to stop. You need to get in a cool area. You need to make sure you start replenishing yourself with fluids, water, or electrolyte solution, whatever you have on hand. And you should seek medical help, because if you have those signs of dizziness, confusion, headache, you're already past that stage of first aid.
Dr. Ernest Patti, St. Barnabas Hospital in the Bronx. Great advice as always.
Yes,
thank you very much for having me. I appreciate it.
What a beautiful day.
It is a beautiful day. Thanks for being here, everybody.
Thank you. Enjoying New York City, right? Good weather for you.
And Jay Sirocco, good luck tomorrow on the marathon.
Bye-bye. Sundays next.